Welcome to Startup Health TV. I'm Logan Plaster, Editor-in-Chief at Startup Health. Today I'll be talking to Andrew Hoppin and Christopher Seeley from a company called CoverUS, which has been with Startup Health since 2018. On its surface, CoverUS might look like another prescription discount platform. And in fact, they do offer people up to 87% off of the medications they need to buy, which is an important offer given that last year alone, 50% of Americans said that they put off needed healthcare because of the cost of care, half of Americans. But CoverUS is about more than saving money on prescriptions, as important as that is. It's actually a health data play that puts patients at the center of the equation. The thesis is that by putting the full power and value and leverage of patient data back in patients' hands, we can push down the cost of healthcare even towards zero. Caught up with Andrew and Christopher to learn about how they connect the dots between prescription discounts and this bigger health moonshot, what they call offering people a financial coach for their health. It was a great conversation. I hope you enjoy. Gentlemen, thank you for joining me today. I'm here with Andrew Hoppin and Christopher Seeley from CoverUS. Gentlemen, appreciate you filling me in on what CoverUS is working on right now. Excited to hear the updates. You know, I love that I love your angle on the cost to zero moonshot because I think it's somewhat unique, and I'm excited to hear you kind of explain what you're working on now. But I feel like you're helping people find interesting and new ways to save money on health. And I think it's more needed now than ever. So could you guys explain to me kind of where CoverUS is at the moment and what your big projects are?
Sure. I mean, when it comes to CoverUS, I think, inspired as we are by Startup Health, we're trying to take the cost to zero moonshot and make it less of a moonshot. And our basic thesis behind that is that we live in a world where your data is used to market to you and sell to you, but it's quite a powerful tool in your hands and can bring down the costs of many important things in your lives, like your healthcare. As you know, we live in a country where more than half of Americans put off needed medical care last year because of cost. And when you look at prescriptions, there's almost 1.5 million scripts that aren't filled every year, which results in about 125,000 deaths, 10% of all hospitalizations, and more than 300 billion in revenue, and another 600 billion in lost revenue for the pharma industry. So we have a scenario where relatively mid-level costs are becoming life or death for people, and we feel that that's really not acceptable. Our motto is that you shouldn't have to be wealthy to be healthy, and our endeavor into prescription drug savings is really the first powerful step in that regard.
Okay, so I've read that you've launched a new tool that saves people up to 87% off the cost of their medications. Talk me through that. How is that possible?
So I'll jump in here. So there's a whole industry called prescription discount cards. And basically what's behind that are folks going around and making deals with drug manufacturers and with pharmacies to be able to sell people their prescription if they don't use their for it at a pre-negotiated price. And the reality, which still surprises a lot of patients, is that often you can get your medications cheaper that way rather than getting them through your insurance. And so there are companies doing really, really well, making a lot of money, spending a lot of money on TV advertising and elsewhere to help make patients aware of that. So that aspect of what we're doing is not new. What is new is that we are doing that in a very personalized way for the people that we think have the biggest challenges in this regard. So you've got about half of America, sadly, with a chronic health condition. And we've got a large proportion of the country that has literally 4 or 5 prescriptions that they're filling every month. Some of those prescriptions would be best filled, if you care about cost, through your insurance. Some of those prescriptions would be best filled by paying quote unquote cash, which in our case really means using a pre-negotiated discount that we offer through the CoverUS discount card. That's complicated to figure out. So what we're doing is we're saying, okay, let's look at your very specific circumstances, your health condition, your specific prescriptions, even your financial circumstances, as well as where you live and what you value in terms of how much shopping around you're willing to do. And let's make this simple for you. Let's make it affordable for you. And let's make it a one-stop shop really for you to be able to optimize your prescription shopping. Again, as Chris said, based on your data. So that personalization is what we think is novel. And it's a great opportunity, we think, because we think there are at least 20% of the country that could save a lot of money with using a discount card that are currently paying more than they need to by going through their insurance or just paying the retail price. And so we're trying to reach those folks that can really benefit a lot financially, simply from being aware that if they use our card, they're going to save money, and that we're going to do that in a way that is tuned to their very specific circumstances so that they can have confidence that they're doing better with us than they could anywhere else.
So my understanding, what I'm hearing is that there's sort of the prescription card side, but then there's this very important patient data side where you're collecting more information about the patient, understanding them to a deeper level so you can give them more customized information. You say that you do that in a really simple way, but you're talking about a relatively complex area of data. So how do you keep it simple? How do you keep it user-friendly? Let's say I'm an older person with diabetes or multiple chronic diseases. How do you keep it simple and patient-centered?
Well, I think it starts with approach, obviously. We don't endeavor to be a service that discount hunters find on the internet. We aim to be your advocate when it comes to your financial health and its impact on your physical health. And I think that's a really different scenario. When Andrew mentioned us talking about Americans with chronic diseases, some of those populations, up to 75% of them have trouble paying for their medication because of their variety of illnesses. So these are folks that badly need the help, and also don't necessarily have the time and may not be well enough to do the same price shopping that others might. And again, these are the people, when we look at a macroeconomic viewpoint of US healthcare, that are driving lots of costs in the healthcare system. So even if you're not one of the 150 million Americans suffering from chronic disease or the 100 million suffering from more than one, you should care about this population. And we're really trying to work with them most specifically. Anyone can benefit from CoverUS, but we're really going to bring you in, create an engaging experience that is user-friendly, and hold your hand through the process so that you can focus on getting well, and we can focus on getting you the best deal to do that. What that means, is a system of technology and user interfaces that seems really brutally simple on the top. You go to our website, the buttons are big, the fonts are large, it's very warm, and that's all very much by design. I know for myself, when I'm not feeling well, and I have, had some chronic issues at times, wherever I look, it feels quite clinical. And it feels a little bit overwhelming to me as someone who's not a medical professional. So I think it's about how we start users. And what we really want to do is engage them in a trusted relationship so that our powerful data processes on the back end can generate recommendations to them that are not only accurate based on the data they share with us, but something they're willing to believe and will use. I think so much of the time when we talk about data in healthcare, we forget the important fact that every line of data in your health record is generally a pretty profound human experience. And I think that CoverUS endeavors to treat it that way throughout your interaction with our products.
Can you give me an example of how personalized it can get?
Sure. So right now, as Andrew said, we're doing something that our competitors aren't, which is showing people the price of their medications with insurance and focusing on people with Affordable Care Act plans. As you know, the recent COVID-induced recession has led approximately 30 million people to have lost coverage when you count the people who lost jobs and their families. They're going to be turning to things like the ACA, and they're going to be turning to discount programs. So whereas our other competitors, who have the same business model as us, which is very simply, when we refer you using our card, we get a prescription referral fee every time you fill. But our job as a company, because of our bigger commitment to a patient-driven product that engenders trust, is not to get you to convert and use our card no matter what. It's to get you to come to us to investigate whether using our card is the best way to save money, or whether you might be better off with existing payment options. So number one, the difference is the insurance comparison. You can enter in your ACA plan data, and we will show you the cost of your prescriptions at your local pharmacies, both with our card and without. And again, we do that because our commitment is to be your financial health advocate, your concierge. This is something that we see as a really long-term relationship with consumers. The other part of it is really when we go a little bit deeper. Over time, we're going to be rolling out many of the things we started CoverUS with, including clinical trial matching, prescription and product and procedure discounts. And to do that, what we want to do is simplify the marketing funnel for all the people in healthcare that want to provide you with life-saving services, but have a really hard time reaching you. I mean, as much as we're providing what we hope is a life-saving solution for patients, we also recognize that the healthcare industry has a real marketing problem engaging consumers. And it seems odd that a product I need at the moment I need it, it'd be so hard for me to connect in an honest and really mutually beneficial way with the people trying to deliver me that product. So the more trust CoverUS can engender with our population by always showing them the real prices, by price transparency, which is one reason we're accepted at 23,000 independent pharmacies that don't accept our competitors, because we're showing you the real price that you're going to pay when you get to the register, not a slightly inflated discount that might motivate you to get there in the first place. So ultimately, what we're really trying to do is be on the side of the consumer, get them to share data with us that we can protect for them, but also use on their benefit to get them the best deal on the product they need at the moment they need it.
Besides showing them transparent pricing, which they might think they're getting elsewhere, but they're not, how else do you engender trust? You're talking about people handing over their data and possibly parlaying this into other opportunities with that data. And so that all has to start with them opening it up and really seeing you as a trustworthy source. So what are some other ways that you engender trust? You could be dealing with a population that is particularly distrusting of sharing their health data. So how do you deal with that?
Well, so, I think it first starts with any exchange. There's what you're asking for and what you're giving. So you, as a person who has a prescription, can go to CoverUS right now. You can get a great discount of up to 87% without giving us any data at all. Okay. If you're a person that has multiple prescriptions to manage and needs to deal with prescription lists and needs to balance the complexity of what to fill where by time and distance and price and insurance, you can sign up for a CoverUS account and give us a small amount of data that allows you to be in the driver's seat on that. Now, if you're a person who wants to engage in some of our other offerings, like the clinical trials matching that we'll be rolling out, and some of the more fine-tuned prescription controls, you can give us data about your health record, your preferences, and we'll do more for you with that data. In 2019, we started with clinical trials matching and pivoted from that due to the fact that COVID has really paused that industry to some extent. And we were really happily surprised. If you look at every survey around, particularly a 2018 Rock Health survey, less than 20% of people, players in healthcare with their data. Everyone trusts their doctor, but when you start talking about pharma and big tech and government, it's 20%, it's 11%, it's 10%. And in our pilot, we had people living with chronic digestive conditions, being willing to connect their health record, engaging in really detailed conversations around what they were dealing with on a health level, and doing so for very modest compensation. In fact, in the post-pilot survey, 79% of the 400 people we surveyed said that there was literally no health or financial data they would not share with CoverUS. And so I don't pretend to have the magic wand on why that happened, but I think it's, we offer valuable services at a quote unquote fair exchange. We're incredibly transparent about what we do with the data you give us and what we don't do. And we, help you protect it. The thing about health data is it's most valuable in the patient's hands. So any company that is looking to take that data out of the patient's hands, try to extract value, is, in my opinion, not only probably doing a disservice to the patient, but also not necessarily recognizing the full value of that data. So we want to allow you to put a signpost out for the people that want to get you what you need to be healthy, and control that engagement so that your privacy is protected.
I'm curious what you think is the full potential of this these prescription savings. One thing that interests me about CoverUS is that you're really working to optimize within the system, and you're finding the savings that are already there. You're helping people to optimize versus offering an entirely different system. You're saying there are savings here to be had, and we will help you navigate. I guess my question is how much potential is there in the system versus saying, look, the system's rotten, it's broken, need a new system. How much savings are there to be had given the tools that you're providing?
So we think that while it is literally labeled the moonshot in our context in startup health, that as Chris said, it's actually practical to drive people's costs materially down. And that's within the existing system by solving the complexity issue and actually making empowering information available to the patient and having the patient be in the driver's seat. So you might think of us like an Expedia for your healthcare shopping if you play this out into the future. And Expedia, to use the analogy, didn't at first give you better negotiated prices. They made it easier for you to find the prices that were already out there. And we think the same thing is applicable here. We also think there's a corollary, and we're very happy to be part of a movement in this regard, where the more transparency there is, the easier it is for consumers to shop around, the more efficiency there'll be in the market and the more pricing power that consumers as a coalition of consumers effectively will have in being able to negotiate effectively with the service providers that are setting these prices. So we think there'll be efficiency gains on top of what already is available, but the low-hanging fruit here is simply make the opportunities that are already available directly available to patients without having to go through a complex process or without having to go through middle people that may or may not have the patient's best financial interests in mind.
Yeah, interesting. So, I mean, one of the things I'm hearing is that in order to really drive that cost down towards zero, I have to be willing to find the value in my own data. You've talked about being able to turn that data over to people in a safe way, in a way that compensates the patient, right? Is that something that's sort of in the future? It's part of the mix in terms of driving costs to zero?
Yeah, I mean, when you think about any consumer exchange, if you looked at my Facebook, you would probably infer that I want to buy some home workout equipment given the COVID situation. But that and that has built, one of the biggest businesses in the world, basically that inference based on my activity. Now imagine you had tangible data about my health, which is evolving minute by minute, and I was allowing a connection to that to be made to present me with opportunities to save on the things that I am going to buy, otherwise I will not be well. That is an incredibly powerful economic tool.
Sure.
But the key for us is that that is a tool that should be in possession of the consumer, not the industry. And so we're definitely not ever planning to sell people's data or to treat data as property and other people the way they're talking about. Really what's valuable in healthcare is your engagement. The healthcare industry wants to engage you at the point at which you need to make a purchase or the point at which you need services.
Yeah.
You do not, by and large, have a trusted relationship with industry. So we want to create a trusted relationship with you to keep you healthy. And by doing that, we cut marketing costs and product development costs and all these massive costs for industry. And we pass that savings on to the consumer. That's the simple model.
Yeah. Yeah. I guess the point I'm trying to drive at is just the idea of the patient recognizing that their information has value and that they own that value. And in order to really drive down these costs, they have to come to that realization, and they have to realize that, look, in the right hands, handled safely, my data has value that I can leverage.
Or they don't, right? Yes, they do. I mean, that's optimal, certainly if they're, self-possessed enough to realize that. But remember, these are folks that are struggling to be healthy, that are struggling in tough economic conditions. These are everyday Americans. More than half the country is putting off healthcare they need because of cost. So this is not a group that we can expect has the time to think about things like this in the way that we as innovators do. So for us, I think it's really about the power behind the statement you just made is what makes CoverUS move forward. But the way in which we engage consumers is much easier. Give us a tiny bit of information, we'll give you a lot of value. Give us a little more information, we'll give you even more value. If you feel comfortable with the value we've provided you based on the information you've given us, if you can trust the process because each time you've given us information, it hasn't leaked, you've been fine, you haven't gotten weird spam, or we haven't abused that relationship in any way, you'll give us more. And this is why we're so excited about the prescription drug thing, because our original clinical trials pilot required so much more information from patients, and much to our pleasant surprise, they were really more than happy to give it once they knew what they were giving the information for and how it was protected. So now we're going on the other end of that spectrum saying, hey, I don't expect that everyone needs clinical trial matching, and I don't expect that everyone is willing to go deep with CoverUS after just meeting us as a company. But I do know that 29% of people in this country skipped at least one medication last year because they couldn't afford it. And the amount of savings that we could generate for them, I think would fill a lot of those gaps.
Gotcha. How has access to patient data changed in 2020, just given the regulatory landscape due to COVID? And how does that kind of play into this move for CoverUS?
So it's both an opportunity and a real risk, we think. Obviously, the potential benefit of data is more evident to more people than ever before, because it can, in some cases, provide you access to crossing a border, or it can provide you with the, in some jurisdictions, permission to go somewhere or not go somewhere to be with your family. And so it's direct and personal and visceral at this point. On the other hand, we see governments, and I'm not speaking specifically about the US healthcare system, but we see governments in some parts of the world using this newfound motivation to share and have access to very personal data to create more of a universal surveillance situation in their jurisdictions. And so I think both because of that reality in some parts of the world and that perceived potential world, there's a lot of wariness as well. And so we think that there's also a risk that people are going to be less willing to share data in a time when they know their data could be used to put restrictions on what they do in their lives. So it really all comes back to building trust, I would say the old-fashioned way, actually being of service to people in a way that they perceive and meeting them where they are, and backing that up with that rhetoric with the reality of actually doing it right. And our team, and this may never be transparent to any of our end users, and that's fine by us, but we think it matters a lot to our business partners. Our team comes from a long history, really throughout our careers, of using data to help people. So we think we're credible messengers in that regard. And we also have the technological chops to back that up with actually doing it right.
And we've also spent a lot of time doing consumer marketing for all the big brands outside of healthcare and outside of sort of do-good businesses that really dominate people's thinking. I mean, you know, Logan, one of the questions that you raised actually had a really practical outcome for us. One of the big things we need to do is educate people just how much savings there is to be had. When we launched our original prescription discount app a few weeks ago, we displayed the discount price of medications. The price in some sense would bring, you know, a medication down from $80 to $9. Multiple people thought that the price we were displaying was the amount of the discount, because it was incomprehensible to them that their final price could be, you know, nearly 90% off of what they've been paying. And so I think this is why the user experience and the trust and the plain spoken language and letting the data be the powerful force in the background, not the thing that we expect to engage people on, is so critical, because this is just, there's so much savings to be had. And I think that people just can't imagine that that's the case. I know I couldn't before I started this.
Are you able to give an example of one of those drastic, are those common drugs for common chronic illnesses that people would know? Those differences in cost, just as like an example to share.
Yeah, it's really remarkable and striking. I will actually literally pull up particular savings that we gave somebody last week, just to give you a very real example. But you've got, you know, for example, let's take something like an inhaler for asthma. You know, something that really can be a life and death situation for a lot of patients. and it's routine that the retail price for that will be more than double what a patient would pay with our discount card. That's on the low end of the spectrum. You've got widely prescribed drugs like statins, which can literally be 90% off when you pay with a discount card. So that all sounds great. And if you're uninsured, it may be the only comparison that actually matters. What we're saying though, and why we think the patients are not availing themselves of these remarkable savings nearly as much as they should, is that it is in fact challenging to figure out when your insurance does cover some drugs, but not others. And when your copay differs for different drugs, even if they are covered. The reality is that most people who have insurance don't pay the retail price. And so it's not that 87% off that really is most relevant. It's actually, should I pay for this specific prescription at the specific pharmacy that I want to go to with my insurance, or should I pay with my discount card? And in that case, the savings that we're talking about can still be in the neighborhood of 50%, even if your drug is covered by your insurance. Most of the time,
and you can get that granular in terms of my insurance and where I'm getting my drugs.
We do it at that level of exquisite detail if you have Affordable Care Act plans right now, and we're particularly focused on that because we think that the people that are turning to Affordable Care Act plans now are those most in need of this cost to zero moonshot during this time of great economic upheaval. And yeah, we will literally tell you, you should pay for this at the pharmacy you want to go to with your insurance because you're going to pay this much and it's lower than the price we can get you. But for this other drug, you should pay with this discount card. And here's how much it'll save you over paying for it with your insurance.
Which is totally different than the pharmacy discount card model that people are used to, where they sort of get the card in the hopes of discounts. There's sort of this veil around it, right?
Exactly. And you hope that the pharmacist...
We're trying to walk you through the process of saving so that you can be well. You know, I think most of us have the financial means to be well if we can flip the power back to the consumers. You know, your earlier question of a typical discount, you know, Andrew's correct in that I think our core product value is showing you how it can be done from a complexity standpoint, meaning, you know, what you can fill here versus what you can save here. But when you're just talking about raw discounts, take something like Lipitor, you know, an incredibly popular cholesterol medication. If you don't have insurance, the average price is about $86. And in our app, it's $8.26. So, you know, that is the type of drug that people are probably paying full price for who don't have insurance because of how important it is. And, you know, now you can save 90% tomorrow. But the real power is maybe you could save even more with an insurance card, but maybe for another drug you couldn't. And how, you know, as a person check to check, as a person who may be skipping medication or, you know, having the doses or doing all the things that people do because of money, can we really expect you to carve out the kind of time to deal with the complexity of these issues? To me, the answer is no. And we want to be your advocate in doing so.
Yeah.
I'll just give one more example of how we address that complexity. If we think of our users as members, you know, not as customers, and that's partly so that we have the context of really caring for you, both your data and your pocketbook. And when you create an account with CoverUS and you become a member, you can choose your favorite pharmacies, you know, as many as you want, and we will calculate for you on the fly your total price of all the prescriptions you need to fill at one pharmacy as versus another, including that complexity of should you do it with insurance or should you do it with cash. So you can imagine that it might be worth it for somebody to drive 5 miles if they're going to save $100, and that would, without our service, be a really hard thing to figure out. Should you even go check at this other pharmacy when you have 4 or 5 prescriptions, and when some of them are best done with your insurance and some of them are best done with the discount card? So we're trying to do add on features like that over time that will really make it that bottom line of I just want to know what my choices are, like literally how far I'll have to drive in order to pay how much money, and to be able to compare that so that a consumer can make a rational decision and again be empowered with that information.
What tools are you using to reach reach consumers?
Chris.
Yeah, sure. So right now, we are doing a lot of direct consumer advertising. We obviously have partnerships, both existing and pending, with lots of organizations and patient groups. As far as member organizations, anyone that wants to provide a financial benefit to folks at no cost.
Mm-hmm.
But one of the things we're really trying to figure out is, can we reach people in an affordable manner? Is there enough understanding out there to advertise to them and acquire them at a low cost? And to date, the answer has been yes. One thing that we haven't mentioned is really about our broader commitment to financial health and healthcare. So obviously, everything we do, as Andrew said, is about viewing our customers as members and taking them through the journey of getting very personalized health savings so that they can afford to be well. But one of the things that we're doing for people outside our relationship is we're really trying to make a company-wide commitment to canceling medical debt of individuals. During the COVID-19 epidemic, we worked with RIP Medical Debt on a special program where we erased $500,000 worth of personal medical debt for healthcare first responders, nurses, sort of the blue collar folks in healthcare who have a lot of debt in their own lives. And actually, even now, systemically with CoverUS, we're going to be retiring $1 of medical debt for every dollar we earn. So in addition to getting consumers real savings, up to 87% on their prescriptions, every time we earn a dollar, we're going to buy someone's medical debt out there, a dollar's worth of that, and relieve it. Because what we have is not just a very personal thing that is causing people to get sick, but we have a economically sick healthcare system. And we think that a lot of people are going to be pretty motivated by an ability to do good while really looking out for their own pocketbooks as well.
Very interesting. I think my closing question is just kind of about what's next. You rolled out this new program. We're in the midst of COVID still. The market is it's a bit tumultuous in terms of how things are shifting. And so I'm wondering how you see the fall and winter shaking out, kind of like what you're excited about closing out 2020 with the new offering and then any other rollouts.
Yeah, so I think it's actually, for reasons that we wish to exist, but I think it's really a fantastic time for our business because it's never been needed more than now. Obviously, we already have a U.S. healthcare system where people don't get the care that they should because they can't afford it, and that is becoming a even more pernicious problem today during an economic upheaval. That also directly affects the bottom lines of every major actor in the healthcare industry, payers and providers included, not to mention the pharmaceutical companies themselves. So all of these actors are aligned with our mission, which is to make healthcare affordable for more people, because everybody does better when people aren't not getting care, not being adherent, not filling the scripts that they should. Because that's going to result in cost, obviously, for payers. And now with the move to value-based care, less reimbursement for providers. So what we're excited about is everybody in this industry coming together and working together in an altruistic fashion to actually achieve this moonshot. And we won't do it by ourselves. It's a moonshot. It needs to be done as a movement. We're really proud to be part of that movement in the context of a community of transformers and startup health. We're proud to have the opportunity to start literally serving in a measurable way that we have data about every day, lots of money for lots of patients. And we're also really excited to start engaging with payers and providers and talking to them and learning from them about how we can best move the needle on the metrics that they have with the solution that we've brought to market here. That'll be true for prescription discounts. Very easy to track that through to the impact on payers and providers. It will also be true as we expand into trials and other things that we think can actually help people get the care that they need at a cost that they can afford.
And it's not just altruism, right? We have an economic situation in healthcare where there's a lot of intransigence, much of it political. And we believe that we've created a microeconomy with CoverUS, where everyone, from the pharmaceutical companies to the patients to the other innovators, can act in their own economic best interest and collectively contribute to a scenario where you don't have to be wealthy to be healthy, and where people don't need to die because they can't fill a prescription, and where companies don't need to lose hundreds of billions in revenue because those folks, can't come up with $50 that might as well be, $50 million in the moment.
Well, Andrew, Christopher, I appreciate your time filling me in. More importantly, I appreciate your dedication to this issue. As a human being, I feel very affected by the cost of healthcare. I feel like so many people have been hit by bills that they struggle to pay, and to have a financial coach for health to eliminate this idea that wealth is required for health is a noble moonshot and a noble journey to be on. So I thank you for the work that you're doing, and I'm excited to see what comes next for CoverUS.